Hi there, it's Uja Ehayog here from Integrated Clinical Strength and Conditioning. So the call to action this week is to start incorporating resistance training into the conversations that you have with patients about weight management in musculoskeletal practice. So key aims and objectives, we're going to explore the role of physical activity, but in particular, resistance training as an intervention to improve body weight management in patients that have musculoskeletal pain. So the current situation in the UK is this. About 28% of adults in the UK are obese. 36%, give or take, are overweight, but not quite obese. The problem here is obesity is a precursor for many other conditions. So that includes conditions associated with inactivity or hypokinetic diseases, as we used to call them many years ago. Stroke, sleep apnea, asthma, type 2 diabetes, reproductive issues, cancer, liver disease, and guess what? Osteoarthritis and back pain, which might actually be relevant, very, very relevant to our own practice as physical therapists and also physiotherapists. So let's have a look at some of the data, because everyone likes a bit of data, don't they? Okay, because unless you have data, you're just another person with an opinion, as we're told, okay, by the researchers. So obesity is associated with inactivity and poor musculoskeletal health. So I've picked a cross-section of studies really to support this particular premise and this particular position. Okay, and here's some additional studies also as well, again, to support my position here, the association between body fatness and also musculoskeletal pain. Okay, so there's evidence there, okay, and although much of this evidence is correlational, okay, in nature, what we're seeing is we're seeing a lot of correlational studies that are kind of saying something very, very similar. So there might be, okay, some truth in this and associated with this. Well, what's the answer? Now, most patients and clinicians, okay, believe that diets are the panacea for all things associated with excess body fatness. Is it? Let's have a look at some of the evidence, not all of it, but some of the evidence. So let's have a look at diet. The big problem with diets, okay, and what I'm talking about is very low calorific diets. The problem with very low calorific diets is you can't stick to them. Okay, you can't stick to them, I can't stick to them, and certainly our patients can't stick to them, because basically it's self-induced starvation, isn't it? Okay, now the good thing, I guess, okay, because we can't completely throw the baby out with the bathwater, is if you're on a very low calorific diet, yes, you are going to reduce your fat. Okay, yes, that is going to be an effect. However, okay, the flip side, or the downside rather, is that what you're also going to do is you're going to reduce your muscle mass, or your patients are going to reduce their muscle mass. How many times have we seen patients come in, okay, and they tell us that they're on a diet, okay, and often that diet is some type of commercial diet, which basically is a very low calorific diet. Now, I'm not here to question these diets, because clearly, okay, they do what it says on the tin. They help to reduce fat. But the corollary with that is that you also reduce muscle mass, and also you reduce metabolism as well, which we're going to go into in a lot of detail in a moment. So keep watching, don't stop just yet. Another thing as well, I guess, is when you look at some of the research, and we know this also anecdotally. So, you know, you don't always need a research study, okay, to support stuff. Yeah, of course, it's helpful if we've got it, okay, because that augments our thinking. But some things are infinitely obvious, okay, and one of the things that's obvious is how difficult is it to maintain the resolve to stay on a diet that effectively induces starvation, okay, or one step before starvation. And we look at some of the evidence, 95% of dieters, okay, regain their weight, okay, when they go back to their usual eating plan, because it's just not sustainable, Yeah. So what we've got to do for our patients, we've got to advise them, okay, we've got to help them, okay, to do things that are sustainable in the longer term to improve their musculoskeletal health, but more importantly, to improve public health and to improve their general health. Okay, because that's a part of our role as well as physical therapists and physiotherapists, health promotion. So I think you'll agree, and I think you knew this anyway before I started talking and before you started watching this video tutorial, diets alone just don't work. So what's the answer? Well, physical activity, of course, is a part of the answer, but I'm going to focus on resistance training, and there's a very important reason why I'm going to focus on resistance training. The big thing about resistance training, okay, which doesn't occur with aerobic exercise necessarily, is what we do is we can increase our fat-free mass, okay, but we also elevate and maintain our resting metabolic rate. When we put that together, okay, with a diet that is very low in calories, what we can then help to do, or we can then help the patient to do, okay, if they're going to go down that road of the very low calorific diet, is to help them to maintain fat-free mass and to maintain their resting metabolic rate. Now you'll understand why in the next slide, why the resting metabolic rate is important, I hope, but please keep watching because the good stuff is about to start. Fat-free mass. What is fat-free mass? Basically, it's anything apart from fat. It's what it says on the tin, fundamentally. Okay, and essentially what we're talking about is bone, it's muscles, it's organs. For us as physical therapists and physiotherapists, the key organ that we're interested in, obviously, okay, which is obviously the best organ, where they're all good, okay, we all need them, of course, is muscle, okay, because that's the fundamental, if you like, that's the fundamental system that we're interested in and that we get involved in clinically, of course. So what about the resting metabolic rate? Resting metabolic rate is absolutely critically important, and from a resistance training perspective, okay, this is where it all gels together. So what is the resting metabolic rate? Essentially, it's the amount of calories we expend at rest. So when your patient is in bed, okay, at rest, they are using, that is their resting metabolic rate. The resting metabolic rate, in essence, accounts for about 70% of our daily energy expenditure. So when we're not actually involved in physical activity, okay, our resting metabolic rate is essentially burning calories. Okay, now for most people, okay, physical activity, it might account for about 20%. Okay, we'll also burn calories when we're eating food, and that's called the thermogenic effect of food, of eating rather. Okay, so yes, we'll use a small amount of calories. Essentially, we'll burn calories to consume calories. It's crazy, isn't it? But yeah, that's what happens. Oh yeah. So, but the key thing here is, okay, what we want to do is we want to increase our resting metabolic rate, or at least maintain it as we get older, to increase our total energy expenditure. If we can do that, that will lead to a negative energy balance. And the interesting thing about dieting, okay, especially very low calorific diets, is it will depress, okay, the resting metabolic rate. So that's not a good thing. We want to stop that, don't we? Because we just said that the resting metabolic rate accounts for about 70% of the calories that we use at rest. So this just really portrays our negative energy balance. Okay, if we're in a negative energy balance, okay, and we're using a lot of energy or expending a lot of energy, then fundamentally our patients are going to lose weight. Okay, and you all know that that's infinitely sensible. Okay, and just I don't say more, do I really? So let's talk about muscle mass and increasing our resting metabolic rate. Well, this is actually quite important because as we get older, okay, so probably beyond the age of about 30 or 40, okay, we can expect to lose roughly circa between 5 to 7 pounds of muscle per decade, unless we're engaged in purposeful resistance training. What that accounts for is about a 2 to 4% drop in our resting metabolic rate, okay, which clearly we just said in the last 2 slides was not a good thing. We want our resting metabolic rate to stay as elevated, okay, for as long as it possibly can be, because that's going to allow us to expend a large amount of calories at rest when we're doing nothing and we're horizontal. So that's a good thing, of course. So we said before our resting metabolic rate accounts for about 70% of our energy expenditure per day. So if we do some simple mathematics, okay, and I'm no genius, I'm actually not very good at maths, but some simple mathematics, okay, roughly, okay, if you think about it from this perspective, 15 calories per day over about 10 years, okay, equals about 15 to 16 pounds of body fat. That's what we're going to gain, okay, by simply, essentially 15 calories. I don't know, what's that like? Is that like a stroke of the knife with some butter on toast, possibly 15 calories? But that's all it would take, yeah, okay, to put on between 15 to 16 pounds of body fat over a 10-year period. If we also add to that, our resting metabolic rate is dropping anyway because we're getting older, because that's what happens. And then we start losing muscle mass. Oh no, it doesn't look good, does it? And if you look down at that slide, okay, what we've got here is we've got an MRI of someone that's relatively old. Okay, what you can see in essence is you can see sarcopenia, but you can see an amazing amount of adipose tissue, or adiposity. Okay, and the key message here is actually there's not much muscle there. So actually, this poor person, okay, is not only is their resting metabolic rate depressed, okay, but also their muscle function is going to be really, really poor. And you know, are they going to be able to function well as they get older? Arguably, probably not. Compare, okay, this to, okay, this slide here where we've got two individuals. We've got someone who's aged 25 on the left and someone who's aged 63 on the right. But what you can see is actually less adiposity and also a significantly more muscle mass. So it's not going to surprise you if I tell you that a 63-year-old, okay, was involved in resistance training and has been involved in resistance training. And that's why the MRI slide looks infinitely better than the last slide that we saw a moment ago. So what do we need to do with our patients? What do we need to encourage our patients to do to improve their muscle fitness? Do we need to do this as an example? So this chap's at the Olympics and he's about to do the Olympic snatch. So he's going to throw this weight above his head with a significant amount of load. Yeah, they think it's all over. Unfortunately for this poor chap, it is now. He's having a bad day at the office, isn't he? Now, clearly, this is not something that we want to encourage our patients to be doing unless they are well trained and have been doing it for a significant amount of time. And actually, if they have, then probably they're not our target group anyway, because we don't need to be having this conversation with them, arguably. But here's some practical guidance. Practical guidance is this: as we all know, we want to combine physical activity with resistance training. If we do that, we'll get indirect and also direct effects on calorie expenditure, okay, for our patients. So they're going to lose weight in essence. So for the very unfit or the untrained patient, okay, which effectively is if they're unfit or they're untrained, if you look at the research, and this is just my quick little way of doing it, when we're trying to apply if you like, research from the strength and conditioning and the sports science literature, and we're trying to apply it to a patient group, well, okay, if we're going to be pragmatic about it, basically if they used a unfit or untrained population group, that's probably going to be closer to a patient group than probably any other group that's in the literature. So for me, that's how that works for me. But in essence, what we want is we want a resistance training. We want to encourage a resistance training where the volume is relatively low. Okay, so 1 to 2 sets, okay, to get them used to resistance training. And we want a moderate intensity. Okay, so we're looking for about a 10 to 12 RM, which is, circa, it's between about, 70 and 50% of the 1 RM, okay, providing there's no reps left in reserve. Okay, progressively we will increase the volume, but we keep the load stable, so we don't push the load up. Okay, but we might increase the sets over time, and this is just some practical guidance, okay, discussions that you can have with your patients in essence. Okay, and why should we combine it? Because some of you may be saying, well, why can't they just do aerobic exercise if they're already engaged in aerobic exercise? Isn't that enough? Well, let's have a little look. Okay, so if they're involved in general physical activity, so aerobic exercise, walking, cycling, running, swimming, that sort of thing, the problem with that is it doesn't replace muscle. Okay, so that's quite undesirable in terms of increasing your resting metabolic rate. Okay, yeah, so as I said there, it doesn't chronically increase your resting metabolic rate. That's a problem. We want that. We want their resting metabolic rate to be elevated. And the good thing about muscle, okay, and building muscle tissue is it requires a lot of energy to keep it going. So that's a really important thing. Of course, general physical activity, it does reduce fat. That's highly desirable. And also it improves cardiovascular fitness. So it's not to say that we don't want to do that. We don't want to encourage our patients to do that, because we need to encourage our patients to do that. Okay, but also as well, okay, because heart health is very important, but also we need to encourage them to take part in resistance training, and most patients will not, unfortunately. Okay, they just will not, because resistance training has never really been particularly desirable, unfortunately. But the good thing about resistance training is it replaces muscle, okay, which is highly desirable. It increases our resting metabolic rate. It also helps to reduce fat via the indirect effects, okay, on energy expenditure, which I've spoken about. And fundamentally for us, I believe it also improves musculoskeletal health, which is critical for us, and obviously very important for our patients' health promotion and general physical health. So in summary, physical activity with resistance training is the best method for maintaining a healthy body weight and also musculoskeletal health. Why? Because it increases fat-free mass and then leads to an increase and a ramping up of the resting metabolic rate. Okay, and I think fundamentally, I think you'll agree, okay, after listening to this presentation, okay, diets alone by themselves, they don't work. Okay, so let's combine things together and let's help our patients, okay, to live as active and as healthy lives as they possibly can. So I'd like to thank you all for listening. Okay, please come and join our community. Spread the word. Okay, our role, our job, my one role in life, if you like, okay, is to put rehabilitation back into physiotherapy rehabilitation. Let's get it back into practice. Let's get it back. Okay, let's get it back in the headlines. So, okay, if you want to follow us, okay, if you want to find out more about us, we're at www.integratedclinicalstrengthandconditioning.com, but it's clinical integrated clinical S&C.com. You'll also find us on Instagram, and I'm on Twitter and as the consultant PT. Thank you very much for listening, and bye for now.